Hello, my name is Ann Lee, and we're going to be talking about the mental health of special populations. We're going to start with the elderly and geriatric population. Depression and anxiety are the most commonly seen mental health disorders among the elderly population. For those elderly age 60 and over, it's estimated that 14% of those live with mental health disorders. And older adults account for 13% of the total suicide attempts within the U.S. and 24% of the completed suicides. The estimation of costs to treat depressive disorders in 2016 for those 65 and older was $9.8 billion. Assessment and screening tools that we can use for this population include the Geriatric Depression Scale, the Patient Health Questionnaire 9, or the PHQ-9 form, the Depression in Old Age Scale, the Cornell Scale for Depression and Dementia, and the Montreal Cognitive Assessment Tool. Our treatment plan in terms of pharmacological interventions, we're going to initially start with the second generation SSRIs or SNRIs or NDRIs. Recommended medications include bupropion, duloxetine, escitalopram, paroxetine, sertraline, and venlafaxine, as these have a lower side effect profile. The big thing to remember with this population is that you should start the dose low at about half the dose of younger patients. It compensates for the decreased drug clearance in older adults, thus minimizing side effects and improving maintenance and compliance with medication treatment. Collaborative interventions include a care management team that consists of specially trained providers such as nurses, social workers, primary care provider, and then should all be supervised by a psychiatrist. Psychotherapeutic options for this population include group cognitive behavioral therapy, interpersonal psychotherapy, and group life review or reminiscence therapy. Perinatal and lactation population. Perinatal mental health disorders can lead to significant maternal and fetal infant morbidity and mortality as a common complication of childbirth. Based on studies completed, it's estimated that about 17% of women experience postnatal depression and about 15 to 20% experience antenatal anxiety and about 10% for postnatal anxiety. The cost of perinatal mood and anxiety disorders in the U.S. economy is estimated to be about $14 billion from conception to about 5 years postpartum. Assessment and screening tools that can be used in this population include the depression screening with the PHQ-9 form, the Edinburgh postnatal depression scale, bipolar disorder MDQ screening, the GAD-7 screening form, the perinatal anxiety screening scale, or the PC-PTSD-5 PCLC form, which is used for PTSD. Next is discussing the pharmacological interventions. These medications are going to be recommended as the second generation SSRIs, including sertraline and fluoxetine, citalopram, and escitalopram. Secondary recommendations include duloxetine, venlafaxine, fluvoxamine, and paroxetine. It is important to remember that providers should start with the lowest effective doses and minimize switching medications that were pre-existing to the pregnancy, and that medications may need to be increased above the usual therapeutic range in late pregnancy. Collaborative interventions, again, that care team that is specialized in mental health, supervised by a psychiatrist, but you do want to include your obstetrician within that care management team. Psychotherapeutic options include cognitive behavioral therapy, interpersonal therapy, and listening visits. Our next population is going to be the pediatric and adolescent population. Children and adolescents commonly suffer from emotional disorders, behavioral disorders, and eating disorders. Most commonly anxiety and depression, ADHD, autism, conduct disorder, and anorexia and bulimia. It's noted that about 20% of children aged 3 to 17 have a mental, emotional, developmental, or behavioral disorder. And the average total cost per episode for publicly funded outpatient services for youth mental health issues was $2,676. Assessment and screening tools that can be used within this population include the Columbia Depression Scale, the Center for Epidemiological Studies Depression Scale for Children, Spence's Children's Anxiety Scale, and the Strengths and Difficulties Questionnaire, which is a questionnaire that is filled out by teachers and parents. The treatment plan for this population, pharmacological interventions are going to be dependent on the condition we're treating. Depression, the recommended first-line treatment is fluoxetine. Conduct disorder, we don't generally treat the condition itself, more the comorbid conditions such as ADHD. Anxiety, we're going to use second-generation SSRIs, which can be used in tandem with the depression treatment options. ADHD, we're going to be stimulants or non-stimulants. Stimulants can include Ritalin, Focalin, Vyvanse, and Adderall. Non-stimulants can be Strattera or Intuitive. And autism, again, we don't treat the condition itself, just the comorbid or core symptoms. However, melatonin can be used to help with sleep regulation, which can be a very common problem in patients with autism. Collaborative interventions, again, you want to have that specialty care team consisting of psychiatrists, specially trained nurses, social workers, and primary care provider, as well as family can be included within that for the adolescent. Psychotherapeutic options include cognitive behavioral therapy, interpersonal psychotherapy, family therapy, peer group therapy, and intensive behavioral therapy. Our next population is going to be the LGBTQ plus population. These patients are noted to experience depression, self-harm, substance abuse, and suicidal thoughts more commonly than the non-LGBTQ plus population. It is noted that about 50% of the LGBTQ plus community have experienced depression and 60% have experienced anxiety. The total annual cost for conversion therapy, including the cost of surgery, therapy, and medications, was estimated to be about $650.16 million. And $9.23 billion is the cost of services for the harms that are associated with conversion therapy, such as substance abuse and suicide attempts. It's necessary to routinely screen the LGBTQ patients for anxiety, depression, and suicidality. The screening general tools that can be used is the Patient Health Questionnaire 2, the PHQ-9, PHQ-9A, and the Generalized Anxiety 7 scale. The treatment plan, these are options that are provided based on the first-line treatment recommendations for the age group itself, such as children, adults, or older adults. The collaborative interventions is going to be that specialty care team as well as a specialist with this population and community resources also. Psychotherapeutic options include cognitive behavioral therapy, which can include programs such as EQUIP, AFFIRM, and Rainbow Sparks, and family therapy. And finally, our last population is the immigrant and migrant workers population. It's estimated that there are about 40 million immigrants in the U.S., making up a total of 24% of the U.S. population. The overall prevalence of depression and anxiety among migrant workers was 38.99% for depression and 27.31% for anxiety. Service use among immigrants with a psychiatric diagnosis ranged from 5 to 40%. Assessment and screening tools can be completed with the same screenings as those general adult screenings or appropriate for their age group. The only difference would be to be culturally competent in your approach, as well as the use of translation services to ensure appropriate understanding between the patient and provider. Same goes for the treatment plan. The pharmacological interventions, collaborative care, and psychotherapeutic interventions are also all going to correlate with their specific age group of the patient. And once again, you want to ensure that you are using appropriate translation services to ensure proper understanding and communication, and be culturally competent in your approach. Thank you.